I've got an exercise for you. Hold up your hand in front of your mouth. Blow a little air. How does your breath smell this morning? Oh, it's a condition that none of us want to have and less of us want to talk about. But bad breath can really cause some embarrassing social situations. But for some people, getting rid of bad breath is a lot more complex than just brushing your teeth. Given this, bad breath expert Dr. Jeffrey Speiser has opened Australia's first bad breath clinic. Good morning, Doctor.
Hi Tricia, how are you?
I'm very well. I hope I'm smelling sweet this morning.
You smell fine down the phone.
How come you saw the need to open a bad breath clinic? Are we really in that much trouble trying to sort of stay fresh?
Well, we are, because bad breath is mostly caused by lifestyle problems. And I initially was treating my own patients, seeing a lot of them that had bad breath issues. From that, I opened up an internet site where I started selling and offering advice about bad breath. We were getting over 2,000 visits a day.
Wow.
Without any formal advertising at all. And it just showed us that basically people wanted to do things from the internet, but there was a large percentage that actually wanted to consult someone about this problem.
Right. Okay, now what are some of the lifestyle issues that you're talking about?
Well, alcohol and mouthwash is probably one of the big ones. Overuse of coffee.
Right.
Is another one. Things like post-nasal drip, if people have nasal problems.
Right. Smoking.
Smoking will increase dry mouth, acid, those sorts of things. But really, post-nasal drip, dry mouth, coffees and mouthwash with alcohol would be the biggest issues.
So can we get to the mouthwash with alcohol? Because that's ringing alarm bells for me. Is that the stuff that we just buy at the supermarket?
Well, most commercial mouthwashes are made with alcohol, yes.
So that actually can cause bad breath?
Well, alcohol will kill bacteria, but at the same time, it increases your dry mouth.
Oh.
And the bacteria will be coming back within a few hours' time, and then when they come back to a dry mouth, they can come back in greater numbers.
Right. All right. Now, what's some of the advice you're giving?
Well, firstly, stop using mouthwash with alcohol.
Don't smoke and stay off the booze.
Stay off the booze. If you don't have a severe problem, in general your body will rebalance itself. So your occasional bad breath issue is not really a concern, and things will look after themselves. People that have nasal problems or dry mouth from taking medicines can cause a chronic problem. And when you cause a chronic problem, you can actually change the bacteria in your mouth, and the problem becomes so entrenched that you need to start using our products or seek our advice. So you first have to decide which category you fall into.
Right.
So for people that are chronic sufferers, I would suggest that they get on the net and go to our website, badbreath.com.au, and maybe ask us for an email quiz, and we can tailor a program to them. Others, basically stop mouthwash with alcohol, brush your tongue. That's one of the biggest things.
Okay, yeah. So
you do brush your tongue, I hope.
Yes, I'll say yes to everything at the moment.
Having a clean pink tongue would be one of the biggest factors. The bacteria that cause bad breath mainly live on the back of the tongue surface, so being a bit more paranoid about tongue cleaning and possibly tongue cleaning with an oral gel would give a better result. It is important to have clean teeth because that is one of the areas that bacteria do build up in, but the tongue surface is a larger area, so you get more bacteria there. If you have gum disease, that's an issue as well because you have a different type of bacteria under the gum pockets in gum disease people. So cleaning teeth is important to keep the bacteria off, but also to prevent gum disease.
Right. Well, it's great advice, and I hope you haven't got too good a sense of smell, though.
You get used to it.
Dr. Jeffrey Speiser, thank you very much.
It's been my pleasure.
Dr. Jeffrey Speiser from Australia's first Bad Breath Clinic.